I think we should do an introduction.
Okay.
Yeah,
Who's editing this? Are
me.
you
I'm
gonna
gonna edit it,
edit?
so don't stress. All right, this is
But you can
Hannah.
say, yeah,
Dr.
yeah.
Hannah Backstrom. Hannah with Backstrom Acupuncture.
It's hard. It's a mouthful.
Dr. Hannah Backstrom with Backstrom Acupuncture in Chicago. And she specializes in labor preparation, a newly minted acudoula, but primarily does acupuncture and Chinese medicine and is going to take care of everything you need.
Literally everything.
Everything. There's nothing
Everything.
she can't
I'm
do.
sure.
I can call you about anything that's going on with me or my family, and you have helped us so much with herbal medicine and like sending us in the right direction for treating whatever random illness me and the
Yeah.
toddlers have.
Yeah.
And yeah, I think I don't hesitate to tell you what we're dealing with because I know you're going to have something that's going to help us. So even though I don't get to come to you to get needled, I trust you. Like whatever Hannah says, whatever, we're taking it.
Oh, that means so much. Thank you.
Yeah.
Okay. Smile aloud. I don't want it. Check it out. Okay. This is my very good friend Hannah Sawitsky with Thrive with Nova. She is one of the best therapists I have ever met in my whole entire life, and she is a fantastic doula and a stand-up human being and a mom who I genuinely look up to.
Thank you.
And and we're here today to talk about breech
We're
babies
talking about breech babies
and ourselves
and our breech babies.
and our breech baby. And I think from a Chinese medicine perspective, a breech baby is a sign of a few things. One, that the mom is under some sort of stress, and so it's more comfortable for the baby to be head up. Like usually it's you'll see a breech baby in times when a mom is being overworked or she has a really stressful job or she's doing something she
Mm.
doesn't want to do every day or fairly regularly. And that's like when you get mad or frustrated, usually but not always, it's this like, oh, like it's this up, like your face gets red, you get angry, you get, and like
Mm.
as women in society, we don't always have the availability, like we can't always express those things. And so, in my perspective, that's sometimes why the baby gets stuck head up
Because
because
the
it's
energy is going up.
because this is like this is how we're feeling, and so like
Mm.
that like coming from that kind of standpoint, starting and knowing earlier, like, hey, this is the position that your baby is tending to hang out in. It's time to start doing some stuff in a more gentle, like you can start doing things more gently if you know
Mm-hmm.
sooner. If you know sooner, that's a really kind thing. So if you're in a situation where you're feeling pressured to have a C-section or your provider is pressuring you to start things and do things you're not wanting to do, considering like, is it an option for you to change a provider if you're already feeling pressured
Mm.
and the baby and you're not in labor yet? Like, is
Mm-hmm.
that sometimes it's feasible at the birth center? I don't know the exact date, but you can transfer pretty late. I'll have to look like how late you can transfer into care here,
Yeah.
but it's possible.
Yeah. I think that that's something that our birth class teacher told us that I try to tell all of my clients is that you can change providers at any point. It's never too late to find a provider that is going to support you and is more aligned with what you're looking for and
Mm-hmm.
that you feel good with, like someone that you feel safe with that's going to help you have the experience that you're looking to have and like give you options for accomplishing that instead
Mm-hmm.
of, well, your baby's breached, so we should just schedule your C-section now. We'll just put it
Yeah.
on the calendar.
Yeah. And well, and that's like a very that kind of provider probably isn't going to talk to you about nutrition or
Mm-hmm.
like getting other needs met or physical therapy, because that perspective, that viewpoint is just, oh, your body's not doing this thing, we're going to make it do this thing without any other
Mm-hmm.
options.
Well, and I think we haven't even mentioned that some providers will do vaginal breech deliveries. That there's
Yes.
providers out there, if you want to find them, that
Yeah.
will do it, and that
Yeah.
it having a breech baby isn't an automatic C-section.
No.
There's a
That's
guy,
totally.
who have I been seeing on social media, who does. I'll find the link for that guy. He does trainings for providers on breech birth.
Oh, what a gift. What a gift to the world
Yeah.
and to women. And
Well, I think for me, I think what I was told was that there was a provider at the University of Utah in Salt Lake that they would do a vaginal breech delivery if I was so committed to doing that that I could go down there. And I remember thinking, like, I'm not gonna go into labor and drive 2 hours. I'm
it's
gonna look for
horrible.
every alternative I can besides going like having a 2 hour drive
Yeah.
in labor. Not knowing what it would be like, I just knew I didn't want to do that. So we went to like a one night spinning babies introduction and learned the three, I think it's called the three sisters.
Probably.
There's three balances, I guess. And we did moxa nightly, which is
Yeah.
like pulling energy downward. Tell me what the goal.
So with Moxa, the acupuncture point is called UB67,
Mm-hmm.
and it's the very outside of your pinky toenail. And in my experience, when you do Moxa, you're supposed to be sitting in a squat position. Yes.
Oh, I was
Yes.
not doing that.
Yes. Find a find a stair, find a stool, sit in your bathroom, and you want to be moderately to mildly uncomfortable while you're doing the moxa in your squat position, because you're supposed to do both sides at the same time. And so
Wow.
it's a twofer, it's a twofold. One is you're kind of you're putting that pressure on your baby, and it becomes an uncomfortable position for them to be in. If they were head down, it would not be nearly as uncomfortable because they would have your pelvic bowl to kind of nestle into, right? It kind of like they would have a little bit more space.
Yeah.
And so like the moderately uncomfortable position is um mildly convincing, like, hey, this isn't super fun, is it? And then the idea with the moxibustion, it's an empirical point in Chinese medicine, which means like we've noticed that it does this, and even we don't know why. So, so like essentially, there might be some practitioners out there who like are like, actually, it does this and this and this. I haven't totally like. There's this idea that it somehow gets to the uterus and bothers the baby
Mm,
enough to get them to move. And that might be it, or there might be an even better explanation out there that I would love to know. And then if you want to like even make it even more uncomfortable for the baby to really motivate them to move, you put a pack of frozen peas or an ice pack on their head while you're scrunched over. while you're, but this, like, none of this is going to work if you are continuing to be really stressed out and
mm,
frustrated and
mm-hmm.
making yourself do things you don't want to do. And like like this is a helpful thing you can do, but none of that's really going to change if you keep doing what you're doing.
Yeah. I mean, it's kind of cool to learn because we used it, but we didn't use it with all those things in
Well,
conjunction.
well, and like that's my over the years, that's my like this is what seems to work, but
Yeah.
none of it works if you don't change your stressors, if you
Yeah.
don't like change the environment that is creating this baby to be upright. And it's not your fault. It's not your fault. You're doing your best.
Yeah.
Like that's also an important thing to remember.
Right. So let's talk more about the environmental aspect, like stress, lifestyle, nutrition that you see being applicable to baby positioning and flipping breech
Yeah.
babies.
So, and I'm going to come from personal experience. For me, I think I was 32, 33 weeks when they were like, this baby has been transverse every time we felt him and done an ultrasound. You need to get on it. And this, I love the midwives here so much. I love them so much. And they were like, you need to start doing things for it. And so I started doing spinning babies. I started doing da 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 da. I would walk around the house with an ice pack. But he did not flip until I took a week off of work and went somewhere else because I was in a really stressful situation. I mean, and you like, I'm an acupuncturist. I was doing moxa all the time. That baby did not. I was getting adjustments. Da, 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 da. I was literally working in an office with a chiropractor and was getting daily adjustments for free. Like, it did not matter until I went on
Mm,
vacation away from the job that I hated, away from the stressful half moved in home that we were living in.
mm,
And it wasn't until I was in a different space, not working, that he went into position.
mm.
He did.
Yeah.
And so, and like, you had kind of a similar, what happened with you? Did you?
Well, it's hindsight because I don't think in the
Right.
moment I was considering my stress levels with the first
Mm-hmm.
and was in a demanding job and um I think all the things that we did, we ended in a version, an external cephalic version. But I think all the things we did to prepare for that made that
Mm-hmm.
procedure go as well as it did. And so we did moxa, we did acupuncture, I did prenatal massage with someone who has a track record of helping turn breech babies. Um, and I remember this is something like the emotional side of having a breech baby. The night before, I had doubts about whether I was doing the right thing by doing the version,
Mm-hmm.
and I wrote my baby a letter, and I feel teary talking about it, but I wrote a letter and I was like, I want to give you the chance to turn. And if this is not what you want to do, I will accept that and we'll make a different plan. But
Mm-hmm.
here's why we're choosing this, and I want to give us a chance to have this birth that I've envisioned. And that helped me, like, get the doubt out of the way. Like, I don't know, I'm making a decision for two people by having this version. And I mean, it's part of motherhood, parenthood is like you're trying to choose the best thing for everybody. And
Forever.
yeah, yeah, all the time. So making that choice was like, oh my gosh, is this the right thing? And is my baby in this position for a reason? Is it a good idea to try to turn them? But we also, oh, another thing we did was hypnotherapy. Like, we did a hypnobirthing course, and our instructor, like, did a breech little hypnosis thing with us. So, like, that was another thing on our list of all the stuff we,
Tools,
yeah, all the tools.
quivers,
Yeah.
but arrows in your quiver,
Yeah. Sure. Yes.
maybe? I
You
don't
got
know.
it.
Tools in your toolkit.
Yeah, but when we did the version, like, I listened to my hypnobirthing relaxation.
Mm-hmm.
So I was like in a relaxed, I feel like my body was relaxed because I had all these other things, tools in my tool belt.
Yeah.
I didn't have fentanyl. Like, I didn't do any pain relief during the procedure because I had all those other things
Yeah.
backing me up. And it went great and it worked. And I went home and was like, oh, damn. She turned over. And she was born 5 days later. Like, honestly, as soon as she turned, the pressure on my cervix was crazy. Like, the whole rest of that day, I
Yeah.
was like, oh my gosh. Because that, I mean, she couldn't get down in there to do her job.
Right.
And it didn't take long. Like, was born at 38 weeks. Happened quick.
Girl. Girl. Yes.
And then the
I
second,
think.
oh, I was just
Go
going to say
ahead.
the second time I had my own practice, I was in charge of my schedule. I quit working weeks before he was born. I took a spinning babies class. We did the balances every day. We did the hypnobirthing preparation stuff. So my stress level, my body was in a different place. And I
Yeah.
think that work environment and like all the stuff that I was holding was different, and he turned on his own. And I didn't, I was
Yeah.
like, oh, I know how it's going to go. We're going to be breech until this many weeks, and then we'll do the version. And my midwife promised me that my old OB could come in. She's like, he'll come if he needs to come. And we didn't have to do it.
Oh, that's so lovely.
Yeah.
That's so lovely. That's almost the opposite of my story, where the first time I got pregnant with my firstborn, it was like I got off work early. I was working for myself, setting my own hours, and he was never even transverse. Like, he was never even sideways. He was always ahead. Like, I got this, because I was like living my dream. And then things changed and things were more stressful. I had less control over my outer stimulus, and I had less
Mm-hmm.
control over the environment I was needing to work in that time. And it, in my opinion at least, it affected the baby's positioning
Mm-hmm.
until I was able to remove myself. I really, yeah.
Yeah. I honestly don't think we give enough credence to the emotion, like how our emotions impact our pregnancy and birth experiences.
Mm-hmm.
Like, it's underplayed and seen, like, we look at it a lot. In the medical model, it's undervalued somebody's environmental, social factors, and emotional factors that play into stuff like this, like having a breech baby or even a labor that's not starting. That we got to be talking about
Yeah.
that.
Then we're gonna, yeah, number, I don't know, it's gonna be happening in our series.
The series we just created. It's happening.
I was just talking to the ultrasonographer. I think that's the word here, and we were talking about how, like, we were talking about breech, and she says she was talking about how, like, moms or people who are pregnant, when they're not embodied and able to,
Hmm.
like, be in their bodies, that's when things tend to go wrong. Like, when you're not able to hear, listen to, and respond to what your body's trying to tell you, especially your pregnant body, like, that's when adjustments happen that aren't always the most efficient, effective. I don't know, but
Yeah.
your body adjusts to make space for whatever you're ignoring. And
Mhm.
it's not always convenient,
Mhm.
you know.
Yeah. I love
I
that
should look up some
observation.
evidence. Yeah.
I think that speaks too to what expecting parents can do, and making like their emotional health and their attunement with their body a priority during that phase of life,
Hmm.
for their sake and their baby's sake. Like, we're actually
Yeah.
all going to be better off if I can address this. and make it a practice to like to listen and
Prioritize
yeah.
your own body,
Mhm.
not just because it's pregnant, but because it's a body that deserves to be prioritized.
Yeah. A hell of a time to learn that lesson. Trial by fire.
Right. Well, I mean, like, it's either going to happen now or it's going to happen, like, down the road when you're at your breaking point as a new mom, which, like, I
Mhm.
myself am guilty of.
Mhm.
I've been a mom. I've been a mom for over 4 years now, and, like, I feel like I'm just starting to listen.
Yeah.
Like, seriously listen and be like, oh.
Yeah. If a pregnant person comes in to see you
Yes.
and they say, "My baby's breech,"
Yes.
what are we asking or looking at first? Where are we starting and where are we trying to help them get?
My number one is I always gauge where they are emotionally and how their stress level is. And do they feel safe with their OB or midwife? Do they feel safe at home? Do they feel safe with their family? Like, what what is your life like outside of being a pregnant person?
Mm-hmm.
And kind of getting to the seed of whatever stressor may or may not be contributing to having a breech baby.
Mm-hmm. Mm-hmm.
And then number two is looking at what's going on physically. Like, are your hips and glutes really tight, making it so everything is like upright and the baby doesn't have space to move around?
Mm-hmm.
Or do you have, like, maybe you have a ton of water and the baby's just like, and that's another thing. But, like, are you, maybe the baby's not being anchored appropriately or, like, not settling?
Mm-hmm.
Um, and then number three is, like, with the moxa, part of the moxa is doing some grounding. And, like,
Mm-hmm.
when you squat down to do moxa, you're treating yourself, you are doing some self-care, even though it's for someone else.
Mm-hmm.
Hello, motherhood. And you're squatting down and you're down low on the ground and you're doing a little bit of grounding while you're giving your, like, while you're touching your feet and giving your feet this attention.
Mm-hmm. Yeah. Well, and I think that all of the things we've talked about, like the moxa, or if they're doing spinning babies, or seeing a chiropractor, or coming to acupuncture, that the theme is self-care. The theme is that you're
Yeah.
setting aside time for yourself and your body,
Mm-hmm.
and that being the foundation of addressing or helping your breech baby turn. That it requires that slowing down and turning inward.
100%. 100%. Man, breech babies, self-care. Problem
Your
solved.
baby's just like, take care of yourself. Hello.
What are you doing, mom? What are you doing? Sit down or don't, whatever it is.
Stand up. Squat.
Stand up, squat. I don't know. Did we, like, as a doula, what are your breech baby?
Mm. Yeah. Well, I get kind of excited about it just because I like my personal experience. I'm like, oh my gosh, this is totally manageable. We can get through this.
Mm-hmm. Mm-hmm.
So mainly dispelling fear to start out with, of like, we don't have to panic. There is
Yeah.
time. There are things we can do. You have options, and emphasizing at every step options. And I think that's my role as a doula in general, is we can have the ideal, but we also have talked through all the different scenarios, and empowering you at each moment of what you want to choose. So if somebody, like, here's all the interventions we can do to help your body make room for your baby to turn. Okay, here's an external version. But then in that version, like, you get to choose your pain management. You get to choose how to go into that, relaxing your body and like those tools and skills. And if baby's not turning, then what options do we have? And so what I would support somebody in is integrating everything that they want to try and leaving it up to them. Like, some parents might say, I would rather just have the simplicity of a scheduled C-section and I'm picking it, but that they pick it because
pick it.
It's what they want, not because someone's telling them it's what they have to have. Or let's try everything else first. And then if it comes down to a C-section or having a vaginal breech birth, like, who can we find to support you in the thing you're picking? And, we have a C-section. Okay, how do we make this C-section as patient-centered as we can? How do we be mindful about how this procedure is going to go? Who in this town is going to deliver your breech baby with you? Just that.
And as a doula,
that there's as a doula,
you would attend a breech birth.
I never have had the opportunity, but I think there's a little bit of, I have an easier job because I'm not the medical provider. Like, I don't have to know how to birth a breech baby.
Come on.
I don't know.
You can do it.
I'm not catching that baby, but yeah, if my client was like, you know what, we're going for a vaginal breech birth, I'll be like, I'll be there. I don't know.
What a gift, because you're giving, like, to your doula client, you open up the world of options and possibilities to them. Like, what a gift.
I also have to be mindful of managing my own fear and biases. Like, I don't want my own stuff to affect somebody else's experience. Just because what I would choose faced with C-section versus vaginal breech birth doesn't matter when I'm supporting a client. It's their body, like it's their experience, it's their baby. So I have to be
literally
I have to be able to manage that. But that's every choice. That's everything in birth. This is not my birth. I'm here for you.
Not my birth. Not my birth.
It's not my baby. It's not my body. So my priority is that they feel good about the choices that they're presented with and like what they pick and why they picked it for themselves.
Yeah. Okay, so let's recap. Let's recap our recap of our recap.
Okay.
Steps to take when you have a breech baby.
Yeah.
Is one is getting out of a place of fear. And that's one. That's got to be one, because you can't make decisions from, like, they're not always good decisions from a place of fear.
True.
Step two, looking at all of your options, like really looking and exploring all of the options available to you.
Yeah.
And sitting with and figuring out what you want to do.
And then you put it into action.
And like, maybe that decision that you make is to change your provider so you feel safer. Super important.
Yeah. Yeah. Beautiful.
Yeah. Step three, in my opinion, is to figure out how to become more embodied. And like how to listen to what your body's telling you.
Mm-hmm. Yeah.
And then there's like all of the other, there's acupuncture, there's moxibustion, there's figuring, like, and they all kind of go from 1, 2, or 3.
Yeah. I think the embodied is even integrated, like to move out of fear and to be able to pick your options.
Mm-hmm.
That's coming. You're gonna get those signals. Like you're gonna know. I'm gonna say yes. I want to say yes to this, or I want to say no to this.
Yeah.
Because I am in an embodied place to make that choice.
So there's just 2 steps.
Get out of fear. Embody. Look at options. Action.
Yeah.
There you go. We solved it.
We solved it. The breech rates and the C-section rates are going to go down.
They're already plummeting.
50%. If you want to talk about options, you can call Hannah. If you want acupuncture, you can come to me.